I want to thank everybody for being with us this morning. We're here to talk about something we think is extremely important relating to continuing to do everything we can to interrupt violence, disrupt violence, and decrease violence in our community. As I've stated before, and I'll continue to state, um, enforcement via Birmingham police alone cannot reduce violent crime in isolation or by themselves. As a city, we've been moving intentionally about creating community based partnerships to continue to address the root cause of crime and particularly gun violence. And so, what we're here today to talk about is this Violence Intervention and Prevention Partnership, which is a hospital linked violence intervention program providing services to hospitalized survivors of gun violence. The objective of providing these wraparound services is to reduce additional acts of violence involving the clients, improve their health, and enhance opportunities for education and or employment. Now, there's a way plainer way to say that with some simple language. We want to prevent retaliation. Retaliation is an all-time high, not just in Birmingham, but in every urban core in America right now. When I talk to other mayors across the nation, um, that part of the back and forth of the increase in gun violence is literally due to one thing: retaliation. This program seeks literally to disrupt that as well as decrease it. This program, paired with 6 additional programs currently underway in the city, will provide the continuance of care to deal with the root cause, again, the root cause of violence. One thing of note I want to make is a huge thank you to some folk you see flanking me to my left and right. That starts with Dr. Mark Wilson, who leads the Jefferson County Department of Health, who I'm trying to convince to stay on the job. Wish me luck, everybody. But I want to thank him for this partnership with our Department of Health. I want to thank him for his commitment and leadership of addressing this issue. We stood shoulder to shoulder back in 2019, declaring gun violence in the city of Birmingham a public health crisis. And so when you have a hospital-based interruption program, you can't do that without a key partner. So again, thank you. I also want to thank Deborah Daniels and the Offender Alumni Association, as well as her team, who she'll introduce in a minute. When I see their faces, I am reminded of my father. My father worked for the state 40 plus years, but in his work, it was all about how, when people come back and migrate back and come back into our communities, how do we make sure they are the citizens they want to be and need to be in regards to being productive, and their quality of life and opportunity, etc. And so this organization is another key partner in this work, but they do many more things that we should make sure people know about today. And last but not least is Dr. Jeffrey Kirby. Now let me get the title right: UAB Division of Trauma and Acute Care Surgery. But what that is this young man and his team sees things that people don't really see every day, and I don't think most of us could handle. Your leadership in this, your partnership in this, you save lives, and we're grateful. And thank you so much. One last thing before I turn this podium over to Dr. Mark Wilson. My colleague, Birmingham City Council, come up here as I call you out. LaTanya Tate, who leads City Council District 9. LaTanya Tate, and representing City Council District 9, is also the chairwoman of the Public Safety Committee. Her passion for this work extends well beyond the enforcement side of crime prevention. She is deeply rooted in prevention and re-entry efforts, and I don't think probably Dina matched your passion, if I'm honest. But with that said, let me stop talking. Dr. Wilson, the podium is yours, sir.
Hi, everybody. It's just really great to be here today and be at this point. It's taken us a while to get to this point. It was back in 2018 that our health department decided to make it part of our strategic plan to address violence as a public health problem and to try to come up with a strategy to address it. 2019, we did, as we typically do about every 5 years, a community health assessment, community health improvement planning process for the whole county. And through the data that was gathered and input from the community that was gathered, gun violence and public safety were identified as the #1 public health strategic issue for our county. So we began looking into the whole topic. It was all new to us at our health department. This is not an area that we had a division for or staff or other resources committed to in the past, but it's become such a problem we cannot ignore it. And it's especially having an adverse effect on young black men. It's a devastating effect, which is a big issue for us in terms of health equity. So we began gathering a lot of input from different experts, different community members, advocacy groups that care a lot about this issue. In 2020, we formed a community roundtable that included some of the people you see up here and others in that category of those who are really committed to making a difference, to look at different strategies, the national models, things like that, and also thinking about what would be suitable for Jefferson County and Birmingham, considering our history, what we've been through, some efforts in the past that have sometimes succeeded, sometimes not, to try to make sure that we were very careful about choosing a type of program that would not only be evidence-based and have some experience from other parts of the country, but also be palatable to our community, that the people that are most affected by gun violence in the communities where they live this would be something that they could accept and embrace. And I would say Dr. Kirby was very instrumental in expressing interest in his work and his colleagues at UAB Trauma Center to really try to do something that would break this cycle. I'm sure they get tired of seeing people every single day come in with gunshot wounds, and they want to do something different. You'll hear from him in a minute. But he, in particular, did help point us to this particular concept of a case management program to intervene in the lives of people while they're still in a hospital bed after they've survived a gunshot wound, to come and offer assistance to them. Our health department then secured the services of the Health Alliance for Violence Intervention, or otherwise known as the HAVI, which is a national organization that provided technical assistance for us and has also provided initial training for the staff you see here to help us launch this program. We then issued a request for proposals. We got our Board of Health to commit funds to this, and I will say our commitment is a long-term commitment to make sure this succeeds and that there's at least some basic backbone funding to help keep this effort going long-term. The mayor has already mentioned the purposes of this program, but I want to state it again just for emphasis. The goals of this program is to reduce the risk of re-injury of people that have survived a gunshot wound. The statistics are not good nationally, showing that if you follow, one study showed that if you follow folks after surviving a gunshot wound over 5 years, 20% of them will be dead by the end of 5 years. Over 40% will be re-hospitalized with another violent injury. So we're trying to prevent that from happening again, keep these folks safe. Try to engage with them to explore what's going on in their heads to reduce retaliation. And then to just help them get back on track to get whatever they need to be successful in life going forward. And of course addressing the issues of their families and their communities that have also been traumatized by these acts of violence. This program will be carefully evaluated as we go along, and we're getting the right people in place and the right data collection in place to make sure we can track this and assure that we are meeting these desired outcomes. And again, as long as we're meeting those outcomes, we are committed to continuing to fund it. And our hope is that because this is an evidence-based program, and if we can show some results, that we'll be able to get additional funding, including federal grants, to really help it grow, because there is a huge amount of work to do. What we have so far, I'm afraid, is just a drop in the bucket compared to what the overall need is in our community to address this very stubborn and complex problem. I do want to say a special thanks to one of our leaders at the Jefferson County Department of Health, Bryn Manzella, our Director of Quality Improvement and Decision Support. She did a lot of very, very hard work to get us to where we are now. And of course, Mayor Woodfin, his staff, including Brandon Johnson, and our City Council, who have been supportive along the way and have committed additional funding to help expand this program after the first year. So we're very grateful for that. And of course, Dr. Kirby and Holly Waller of the UAB Trauma Service for their partnership in this. And of course, our partnership with the Community Foundation of Greater Birmingham for their assistance in our grant making process. This is a grant from the Health Department to the Offender Alumni Association to run this program. And I will say there was a very, very careful grant selection process with several different applicants. We had a grant review team of 14 people, including Health Department people, city people, and our UAB people and our other community stakeholders, to help choose the right organization to do the case management. And these are the folks that were chosen. And I will say a lot of it has to do with heart. And you'll hear that when you hear from them. So I think I've said enough at this point, but I thank you all for being here. And now I'll let Dr. Kirby give his remarks. Thank you.
Good morning, everybody. It is really a pleasure to be here today to officially announce the launch of our hospital-linked violence intervention program for the Birmingham communities. UAB Hospital, our trauma center, and everyone involved with the care of injured patients at UAB are pleased to be able to partner with the City of Birmingham, the Jefferson County Department of Health, and the Offender Alumni Association to provide this service to victims of firearm injury in Birmingham and the Jefferson County communities. Firearm injury is one of the most important public health issues in the country and impacts communities not only in Birmingham, but in other municipalities across the United States. Firearm injury is now the #1 cause of death for Americans age 1 to 25. Let me repeat that. It is the #1 cause of death for Americans age 1 to 25. Since 2019, there has been a 23% increase in the incidence of firearm-related injury and a 46% increase in firearm-related homicides. Last year, our UAB Trauma Center cared for 1,300 victims of firearm-related injury, nearly a 4-fold increase since 2010. Hospital-linked violence intervention programs are a key piece of an overall public health approach to address the issue of firearm injury. Over 40 hospital-linked violence intervention programs like this one have now been established across the country. We know there is a high rate of repeat injury after being a victim of a firearm-related assault, typically in the range of 20 to 40%, with 20% of homicide victims treated for a violent injury in the 5 years preceding their death. Hospital-based violence intervention programs provide a way to potentially break the cycle of injury, with results from some programs showing a 4-fold decrease in the rate of repeat injury for victims enrolled in these programs. So we are pleased to be able to partner with these other organizations to launch this program. While this is not a total solution to the epidemic of firearm injury in our community, it is a vital component of an overall community violence intervention strategy, and we are excited to be a part of it. So thank you. I'll turn it over to Deborah.
Great morning, neighbors, family members, and friends of Jefferson County. My name is Deborah Daniels, and I am the co-founder and the executive director of the Offender Alumni Association, also known as OAA. OAA is humbly honored to serve as the case management provider and operator for the Violence Intervention Prevention Partner Hospital Link program, conducted in collaboration with UAB Hospital Trauma and Acute Care Surgery. The Offender Alumni Association Violence Intervention Prevention Partner currently employs a violence intervention supervisor, whom you will hear from shortly, 2 violence intervention specialists, a family engagement and youth engagement specialist. 95% of OAA staff are credible messengers with relevant life experience, similar to myself, who serve in a variety of capacities and as leaders in our communities. The Offender Alumni Association vision is and always has been to reduce crime and restore our communities. OAA realizes that violence never has a winner and that it never affects one person. It destroys families and communities. The violence intervention specialists connect with survivors of gun violence with follow-up care and community resources to maximize recovery and to create a path to a meaningful and productive life. The violence intervention specialist overall goal, this program is to reduce risk of re-injury and retaliation. The OAA Violence Intervention and Prevention Partners, it is designed to demonstrate that through unity, all of us working together, we can, we will, and we must address gun violence, because where there is unity, there is victory. OAA is honored to unite with our city leaders and our community partners and county leaders to enhance public safety. It is my honor to bring to this podium our violence intervention supervisor, Carmone Owens.
Good morning. Again, I'm Carmone Owens, and I'm blessed to be the supervisor of our Violence Intervention Specialist team, and we're very thankful to be underway doing this great work of ours. Life is never quite the same after a gun violence episode in someone's life, and there's a lot of moving parts, a lot of pieces that have to be put back together. We're seeing victims from a variety of different situations, such as robbery, family situations, domestic disputes, hanging out in high-risk places, and just bad life choices. But the pieces have to be put back together. Life has to go on. We're very happy to be able to have relocated one of our clients. We're helping with family engagement with our clients. And the particular client that I'm speaking of that we relocated was a victim of a robbery and didn't know how he was going to go forward because he didn't feel comfortable or safe going back to where he came from. Our team was able to meet with this individual, work with him, provide resources and services, move him out of that dangerous situation to somewhere where he and his family felt he was safe, move him again to another situation where he felt further safe, and helping him achieve some of the goals that have always been there. This problem is very complex, and these things happen for definite reasons that have underlying risk factors that our team is working on to help people with. There's substance abuse issues, there's mental health, there's family engagement, there's living wage issues. There's a lot of things that our team comes together to help people put the pieces back together and move forward in this great work. I'm very thankful to work for someone as passionate as Deborah Daniels and Offender Alumni Association, because we do care about this. And as a former gunshot survivor myself, and our team also who have this lived experience, we are passionate about this work, because this gun violence problem affects everybody, and it's not going to change unless we change it. Thank you very much.
So we're open for questions now, if you have any questions.
I have a question. This is for you, Mayor Woodfin, and it's because this is so important, and I think based on the number of people in the room to cover this, you can see the interest tonight. Let me ask the question about how you translate to the rest of the community why this is so important. How does it make the other people in the community feel safe when we are working specifically on this targeted group of people?
I think the community should know that this is the type of investment that has a full return. When you have interrupters that can go into a hospital at whatever level the victim is in, and be in a position before their discharge to change their life, assist in their life, help them prevent further trauma, either for them returning or worse, them being killed, or equally retaliation where they go shoot somebody that shot at them but they survive. This is life changing. And when we consider two things: one, retaliation is too high of a level, or the back and forth, but people are surviving until somebody is killed. We can reduce that. This type of program literally allows for us to be able to decrease retaliation. But what I really love about this program is, do not be fooled by what both doctors said about that percentage. That's high. And any opportunity to save a life, this program is literally saving lives by decreasing the risk of this person being shot again and or worse, being killed. This young lady was second, I believe, and you're third.
So I know Dr. Wilson and we have talked about this program starting about a year ago. One thing you emphasized to me was getting it right, and that meant who you chose to have in that hospital with those victims. Can you just re-emphasize that now, because we are now a year out since we've talked about it, and it appears as though victims have already been helped. So you just touch on that.
Yeah, and I will say it has taken a long time. Like I said, we started thinking about this in 2018. Of course, we had a little pandemic that kind of preoccupied us a little bit. But part of the reason it's taken so long is we have been being extraordinarily careful about the process. As I mentioned, being very careful to make sure we get lots of input, spend a lot of time listening, and not just being like, oh, the health department's deciding they're going to do this, or the city's going to do this. It's top down. We did not want to take a top down approach. And we do know that our community, there are trust issues in our community. Whether it be, trusting, certainly there are trust issues with our health department. People don't necessarily trust something that we're pushing out. So we had to be sure we were careful about that. And then just the simple, not simple, but as I mentioned, the technical assistance, looking at the model and making sure there's fidelity to the model that's been proven to work in other communities, and getting the appropriate expertise in terms of the process of getting it started, being very careful in our selection process, the granting process, and then the training. These guys have been trained. There's more ongoing training and technical assistance that will occur. So I guess I'm just saying all this to say that we have been very, very careful. At least for me, there is a certain amount of fear and trembling as well. This is very, very difficult work, challenging work. Being on the front lines, working with folks that have been traumatized like this and in communities that have been traumatized, it's tough. It's messy. But as much as we can, we want to make sure that we're being very careful about the process. We're gathering data. If something's not going right or we see opportunities for improvement, we tweak things and make improvements along the way. So we're being very, very deliberate, and I hope that will translate to real meaningful success.
I'm not sure who would be the best person to answer this, but can you give us a clearer picture of what these services will be? Someone had mentioned it starts right at the hospital bed and it continues to when the person gets out of the hospital. What is provided to these people, step by step?
The initial intake is finding out what happened and how can we help, and what does the patient actually need. What are the deficits? Then we go from there to setting up an action plan for before they get discharged from the hospital. What are the primary needs that they have? What are the primary things that need to change? And what are the things that are going to make them feel safe and help with their recovery? We've got 4 major areas. We've got the continuum of care. We've got getting them to a living wage. There's a family dynamic component, there's a child dynamic component, there's an environmental dynamic component, and then there's the other issues that might be in play, be it substance abuse, mental health, family dynamics. It's based on what the client's needs are, and then they tell us what they need, and we help them get from where they are to where they're trying to go to. We meet them right where they are.
Just get them to the living wage.
Well, getting them to a living wage is going to definitely take a process, all right? After experiencing that kind of trauma, people need time to heal mentally and emotionally. So we have partners in the communities that we rely on that will begin to employ these individuals once they have recovered from their injury. Now, what we're seeing is those who are survivors of gun violence, they're not able to go right back to work all the time. So we're connecting them with some mental health services. First of all, you've got to get them to a point to where they are healthy, mentally, emotionally, as well as physically. So that's our plan.
Can I ask you just about while you're there, you can hear your passion. It just comes through. Is that hope? Is that frustration? Is that desperation? What is that?
I think it's a little bit of all of it. Having been a former offender myself and been in the streets, but also now as a grandmother with 14 children living in our communities, I want them to have hope. I want to see this change, the gun violence reduced. My desire, my heart passion is not just about my kids, it's about all of our kids. And that's why I say it's going to take all of us uniting. It's not just the Offender Alumni Association that can do this work. And we know that. And we want our partners to rise up and realize the importance of serving, actually servicing these individuals with their heart and their life. Because we have to do this. It has to become all of our passion, not just mine. But yes, I have 14 grandchildren.
And in truth, we are all victimized by this violence. I was in D.C. in December, and 24,000 families lost their children and their loved ones to gun violence. This isn't our problem, this is our problem as a community of people that are concerned about individuals. And we can't say that any better or any more. We get in there, we meet them where they are, we build relationships with a person that has been victimized first, and we move them forward at a rate that they need with compassion and care. What he failed to say is that one of those individuals is already working on getting his education to do something because he may not be able to go back to work in the capacity in which he went, but he understands that my life can move forward, and that was with intentionality and with a lot of care.
Within this strategy has like 6 different partners. Can you talk about is there a parallel nature to this work and police and law enforcement? And I recognize the challenges for the interrupters in that space, but as a leader, how do they parallel, if they parallel?
You know, I'm fortunate to be in this work with a city council that is committed to public safety. We talk about our budget from a number standpoint, when we talk about a priority standpoint. But when we go deeper, when I have the opportunity to listen to, and I literally listen to What the committee chairwoman says of public safety, Latonya Tate, all of this is partnership. I think the expectations are lopsided sometimes, or hard to manage. And what I mean by that is people think the police are literally supposed to do everything. We have a decrease in our city's population from 340,000 people to 200,000, but we got an increase in the calls, and people call 911 for everything. You have a credible messenger that evens the playing field, where people just don't have to depend on Birmingham police officers. That there are people out here in the community that can solve problems, that can negotiate, that can mediate, that can literally intervene and dissolve disputes, and literally they mediate conflict. And there's unfortunately an overwhelming amount of conflict that exists in community. But when you have people who live in community, from community, and their heart is with the people in community, they have as much credibility as anybody else to solve some of these issues of conflict before somebody is shot, when somebody is shot, or to prevent somebody being shot again.
Overall, we're looking at a number of programs. It's not the only one that we've put into place in the last 6 months to a year. Over $6 million worth of investments. You highlighted that this is a multi-layered attack against this. Can you kind of touch on that and how it's important to have several opportunities to really fight violence?
Absolutely. Again, you have a toolbox, and there are minimum 3 tools within this toolbox of addressing and fighting crime. One is enforcement. We do that through our Birmingham Police Department. They have a significant budget, men and women on the streets every day, a patrol and other forms, investigative bureau, etc. But then these other 2 tools are when the people you see standing here comes in, and that's prevention and reentry efforts. We believe those millions of dollars towards prevention and reentry related to conflict resolution, related to violence interrupters today, related to other programs. Collectively, this is what we're saying. The community's on notice that your city government, through partnership and collaboration, are doing everything we can to address crime, and particularly gun violence, and reduce gun violence. All of that collectively still can't do it if the community doesn't step up as well. The government cannot do it all.
At what point does this information make it back to police? I know you all are fighting for retaliation when that person has to go back and retaliate, but what if the person that did the shooting comes back to the victim knowing they survived? So at what point will information lead to police about their suspects?
We don't have a direct relationship with the police in that capacity right there. Our emphasis is on the client and in the community, and connecting the client to community-based resources that help with this. Because a lot of times, if you take care of the primary needs, see, that's one of the issues right there. Is there's a lot of needs that haven't been addressed that caused this situation to happen in the first place. So our team is committed to connecting victims to resources that address those needs, and then you start. That's how one of the ways you deal with the retaliation issue. People have been wronged, they've been hurt, they've been injured, they've been wounded. So we're helping people come back together to be whole. There's a lot of needs such as housing needs, there's social determinants of health, there's living wage, there's training opportunities. So the VIS, our specialty, is connecting people with the resources that exist that they don't know exist that help solve their problems. And when we get them focused on that, we're able to deal with the other issues like retaliation.
How do you get folks to participate in the program? And do you anticipate challenges in that, or have you already seen that? In terms of just, talking to people in this situation, maybe someone who's reluctant, I'm not sure.
For us, that's the easy part because of our passion, because of our lived experience, because of our training and expertise and our heart for doing this work. People want help. They don't know who to ask for help. People want a pathway. They don't know how to get to that pathway. So that's the easy part for us, because once people understand what we're looking to help them do, they're eager to sign up for us and help us.
I got 2 more questions. I saw. Okay, 3.
This is for Dr. Wilson, because I'm curious how we catch people further upstream before they get involved in a violent incident. You mentioned people don't know who to call. So are we looking to a point where we
Well, I'm gonna follow up on this question first because they're a little bit related. There is a process where the hospital determines somebody who might be suitable for this program. Part of it is it's limited to Jefferson County only, and of course UAB Hospital serves a whole big region. So there are some criteria, and there's an age criteria as well. This is currently designed for age 19 to 39. We decided to focus on an adult population that is of age of consent initially, but there's a consenting process before the hospital gets consent as to whether the person is interested in the program, and then gets permission for these folks to come to the bedside. So that's that process, and certainly some people are going to say I don't think I need it. Some people are saying they don't want it. That will happen, and then there will be some for various reasons who are not good candidates. That's just to sort of pull that out. To your question, there's a lot of you could say this is downstream, and public health really is supposed to be more upstream, preventing things from ever happening in the first place. And there is a lot of work that is being done and needs to be done, not necessarily by our health department. We decided to just, as I mentioned earlier, find a program that we felt that we could support, put some of our financial resources and other resources into that we felt was effective. Now, prevention, and I think this is true of some other public health problems, some public health problems have a cyclical nature to them, and this is one of them. So that even though it's downstream, it's also upstream at the same time, because we've talked about retaliation, or just how people are traumatized, families are traumatized, whole communities are traumatized, which makes people more likely to be involved in future violence. So I would love it if we could just have a sit down with our young people, while they're in school, and do some magic to where they would never commit violence going forward. It's not that simple. That work needs to be happening, and there are organizations that are doing that. I will say another program that we helped start with another partnership with the UAB School of Nursing is the Nurse Family Partnership, where it's a first-time pregnant women who are low income. They are offered the opportunity to have a nurse come alongside with them, starting at by 26 weeks of pregnancy and following them with home visits, up to 64 home visits, until the child reaches age 2. That program, very intensive, resource intensive. The evidence base for that program, which has been in other parts of the country for decades, shows that those children are less likely to be victims of abuse, that those families are more likely to succeed financially, and that the children, by the time they reach the age of 15, are less likely to be involved in the criminal justice system. So that's primary prevention, and that first 2 years of life is critical, and that's why we've invested in that as well. But we can't do it all. We're just trying to help out is sort of the bottom line. It's going to take a multi-pronged effort by multiple governmental agencies and community organizations to address this problem.
I got you your last two.
Can you explain the ages again, 19 to 39? Just this past month, we saw multiple children killed with gun violence in Birmingham. Are there plans to open up to minors, hopefully in the future? Some people might say that the children are the most vulnerable who need that help.
Yeah, I'm glad you asked the question because, we, again, I mentioned fear and trembling before. We're trying to make sure that we start in a place where we can get it right. And the whole issue of consent for a minor is just more complicated. But Children's Hospital has reached out to us with some interest. Certainly the doctors, they're, just like Dr. Kirby and his staff, who sometimes these children die in their arms in the emergency room. They really, really want to have a program like this. So yes, we have been talking about expanding it. Once we get our feet wet, get some more experience, work out the kinks to move into that space. We'll need additional funding, but I think we can get it.
Last question, good sir.
I was just gonna ask, do we have a number of how many people have involved in the program thus far?
Hi, y'all. I'm Timothy Lanier. I'm a VIS. Right now, we have 7 participants. All of them right now are working toward their recovery. They're engaging with us on basically a day-to-day basis. We talk to them constantly. We become not just VIS. We become friends with intention. Okay, and these intentions are to make their life the best that they want. They want to be better. We want to help them get better. Now, we can't force nobody to do anything. We don't try to push anybody to do things. We want them to decide that their change is going to be their life. And as they change their life, we're going to be there to walk them through it. And it's a 1-year program, depending on where they at. But it's a continuous relationship even after the program. We're looking at support groups. We don't just deal with the individual, because once the individuals see us come in and talk, their family becomes engaged with us. And as the family become engaged, when you talk about front and back end, they don't want to do anything to hurt the member. So they try to learn what they need to do to make the whole family dynamic special. And we just push them to let them do what they want to do. You know, I mean, they're not perfect. We're not perfect. The city not perfect, but we're working toward perfection. And that's all we could do. I mean, we want everything in this city to be better. We want to grow. We want our people to be safe. This is what we do it for. You know, we did this without money. We were doing it before we entered this right here. This beautiful now. But we've been doing this. We don't become credible by coming and standing right here. It's lovely. Nice lights, all this. That's beautiful. But our work is not glamorous. But it's glamorous to the people we help. And that's what's important.
How long do some of these relationships last between the clients?
I mean, it can last as long as they want it to last. Okay, we're not putting a limit on our relationship. We put a limit on the program. But they might need a call. I get calls at 12, and I just want to talk to you. I got a call today from a boyfriend of a client that was having problems because the client is hurting. But he don't know how to deal, because emotionally he's going through something because he is in love. So instead of just saying, man, just I talked to him about how he should feel. You still have to have your self-worth, even though you're helping somebody else. Don't let nobody misuse you. But understand that this person needs you right now. So, okay.
Oh, I'm sorry, who was about to, no, I was gonna say, we need to wrap up, I know.
Okay.
There are other people